Welcome everyone to the 10th webinar in the Governing for Reform webinar series. Our focus today is on exploring the role of governing bodies and executives in leading digital adoption and innovation. My name is Evan Rawstron. I'm KPMG Australia's National Sector Leader for Health, Ageing and Human Services, and I'm delighted to be with you all here today as your host. Before we jump into the panel discussion, which I'm really excited for, I just want to take a moment to recognise that I'm joining today's webinar from the unceded lands of the Gadigal people. I'd like to acknowledge their deep connection with and stewardship of this place for more than 60,000 years and pay my respects to their elders past and present, and welcome and extend my respects to Aboriginal and Torres Strait Islander colleagues that are with us here today. I also know that we've got people joining from all around the country. Can I acknowledge the traditional custodians of the country you're joining from and extend our collective respects to their elders past, present and emerging. The world we're all operating in is becoming increasingly digitised. Every new clinical device, monitor, communication tool is digitally enabled and often mobile. Increasingly, equipment such as wheelchairs and the beds that we're buying are actively broadcasting information, and all the while we're operating alongside an unmanaged ecosystem of smart devices being used by patients, visitors, their family members, staff and other third parties like contractors in our facilities. As is the case in many other sectors, aged care is moving inevitably towards a digital boom, enormous change in the sector that we're all focused on. The use of technology in our sector has the potential to change the way that providers deliver services and to improve consumer outcomes. Organisations that view technology as an enabler of improvement and change are better positioned to be able to respond to change, identify opportunities for improvement, and continue to deliver great care for consumers. For today's webinar, I'm delighted to be joined by Julianne Parkinson, Nathan Bettridge, and Angela Ryan, all of whom I'm going to introduce in a moment. And I'm really excited for the conversation that we're going to have. The overall aim of the conversation today is really to explore, as I said earlier, the adoption of digital technology and innovation in aged care. We want to spend some time exploring why it's crucial for executive leaders and governing body members to lead integration of digital technology into your service offerings. Before I jump into introductions, I am conscious that while many of you joining us today are active participants in the program and have been for some time, there may be others that are quite new to Governing for Reform and may be wondering what it's all about. So if you're here for the first time, from all of us, a very warm welcome to you. As a registered program participant, if you head to the Governing for Reform website, you'll have access to the full range of Governing for Reform resources that we shared prior to this event. Those include things like the Information Communications and Emerging Technology in Aged Care podcast, the Tech and Cyber Security Toolkit, and the Information Management module. You'll also find that there are recordings from all of our previous webinars and information about opportunities to get involved in other parts of the program. We've also just uploaded our governing body packs, which support you to work through aspects of the Governing for Reform program collectively as a governing body. Before we dive into the panel conversation, can I also just draw your attention to the layout of the screen? You'll notice that you can manipulate the screen by dragging boxes around in any way you'd like, and it enables you to see the presenters in full screen if you'd like. You can also expand the various windows by clicking on them to suit your preferences. It's a really flexible platform that we're using today. We're very keen to make this an engaging discussion and to make sure that we have the opportunity to answer questions that are important to you. So if you'd like to submit a question for the panel, please just drop it into the question and the answers box on your screen. We'll aim to leave about 10 to 15 minutes at the end of the event to select a few questions for the panel members as time allows. In terms of the panel introduction today, as I said, I've got the absolute pleasure of hosting three panelists with different but incredible and complementary experience, all of which is really relevant for digital adoption and transformation in aged care. Please join me in welcoming them to our panel today. I might just start by introducing Julianne first. Julianne Parkinson is the founding CEO of the Global Centre for Modern Ageing. She's a regular speaker at conferences around Australia and throughout the world, and also serves on international judging panels for prestigious industry awards. Julianne is a graduate of Stanford University's Graduate School of Business Executive Program and also the Stanford Business School Innovative Technology Leader Program, both in 2022. Julianne is a graduate and fellow of the Australian Institute of Company Directors and is an active board director on a range of industry bodies. She also holds a number of roles at the University of South Australia and is an adjunct industry fellow at that university. Julianne, it's wonderful to have you with us here today. A very warm welcome.
Thank you.
Next up, welcome, Julianne. Next up, Nathan. Nathan, thanks for being with us today. Nathan brings a fascinating range of experience, I think, to our conversation. He had an extensive career in corporate marketing and management, following which he co-founded a peer-to-peer fundraising platform called Everyday Hero, which went on to be one of the leading platforms of its type in Australia, the UK, New Zealand, and the US. After Everyday Hero was acquired, Nathan spent several years working with the fitness tracking industry to better integrate fitness activity from personal devices into fundraising data to create improved fundraising outcomes. As he was working through that, inspiration struck, and he started a new career in home health using personal data collected in and around the home to drive better health outcomes. So as the co-founder now of a company called Five Good Friends, as well as the home health software startup Lookout, Nathan's really driving change in the way that consumers are supported to live happy lives for as long as possible in their homes and communities. Nathan, great to have you with us. Thanks for taking some time out of your busy schedule today.
It's a pleasure. Thank you.
Last but by no means least, Angela Ryan. Ange, thank you again for being with us today. Angela is a recipient of the Brilliant Women in Digital Health Award in 2021 and in 2017 was a Churchill Fellow. Angela has an extraordinary and decades-long career across the Australian healthcare landscape. She's worked in senior leadership, executive and clinical roles in federal, state and local settings. Ange has extensive experience in senior leadership and of particular note in the digital health space is the Vice Chair of the Australasian Institute of Digital Health and was formerly the Chief Clinical Information Officer for the Australian Digital Health Agency, where she was instrumental in driving adoption and innovation in Australia's digital healthcare landscape. There are a few people that have made such a broad contribution to digital healthcare in Australia, and so I'm delighted to welcome Angela and our other panellists to the panel today. So as I said, thank you, Ange, for being with us.
Great. Thanks, Evan. Really great to be with you all.
So as I said, we're going to dive in. We want to explore the role of governing bodies and executives in leading digital adoption and innovation in Australia's aged care system. That's a huge topic. And in talking to the panellists about where we might start today, I'd like to start with the topic of opportunities and risks presented by digital adoption in aged care settings. Nathan, I might ask you to start us off. I guess as you reflect on your career and particularly the work you've been doing over the past few years, what are the top 2 or 3 opportunities that you're seeing for aged care providers to realise value, whether or not that's in terms of safety or consumer experience, quality of care, or how much it costs to serve consumers from digital adoption?
Yeah, thanks, Evan. Look, I think you're seeing, and we've seen over the last few years, ongoing review of processes and really getting those processes efficient and wherever possible then automating those processes. That's a natural, push towards greater efficiency to drive value. We're now seeing the adoption or application of some type of either AI or other types of overlays to really prove the value of that automation. What we're now starting to see emerging, which I think is a really exciting opportunity, is the monitoring that you said that was disaggregated. We're now starting to see good providers aggregate that monitoring and bring transparency to that data. That's actually helping them direct the needs to those people who have the professional capability and enabling their professional workforce to operate at the top of their license. So we're really starting to see those sorts of prioritizations through that transparency that the data is able to give them. And ultimately, I think that the next evolution that people are starting to see is that through that transparency, you can actually start to increase and improve the consumer experience. And in aged care, in our experience, at least, the family is actually now starting to participate at whatever level they choose because of that transparency and that digital adoption, which is going to be a great driver for value-based healthcare into the future.
Thanks, Nathan. Julianne, I'm keen to draw you in on this, given the unique perspective that your organisation has. How are you seeing benefits changing for aged care providers from digital adoption?
Well, I think, to build on Nathan's comments there, it's around the care for the workforce, of how we improve the attractiveness for the care work and the care worker participation, and improving the career pathways. And technology is certainly playing a role in helping in the scheduling of our workforce, but also in the ability for digital platforms that allow to engage with different sorts of care workers that might otherwise have not been attracted or capable of accessing the sector to provide services that are so desperately needed. So I think the improvement that the digital platforms provided to workforces are tremendously important.
I think, Nathan, you picked up that point earlier about, working at the top of our game, not the top of our capacity, which has obviously been one of the critical issues, I think, for aged care settings for a long time. And obviously there's a lot of experience in the nation's healthcare system on digital adoption. It's been a big topic in that setting for a long time. I wonder if you've got reflections on both some of the sort of opportunities, some of which Julianne's touched on there, but also the risks that emerge for providers as they start to walk down the path of digital adoption.
Thanks, Evan. Look, I would say one of the sort of very recurring themes is around that sort of resistance to that change. I think that, like anything, technology is, while it can be a transformation, it's sort of it's essentially a change. And, not everyone it's not something that most people are generally comfortable with. And there's sort of a range of different sort of attitudes, I suppose, to introducing such a change. And you've got your early adopters, you've got sort of innovators and early adopters, then you've got early majority, then you've got late majority, and then you've got laggards. So you kind of need to accommodate the fact that there's going to be a range of responses to that change. And essentially it comes from fear. So I think one of the things that we have done sort of, throughout these changes over time is to really engage people very early on in that change. I think that engagement can't be overdone. People really need to understand, well, what is the purpose of this change? Why are we doing this? Because if they don't understand why this change is occurring or why the technology is being introduced, then it's going to be difficult for them to see any value and to really stay engaged with it. I suppose the other significant barrier there too is cost. And cost sort of comes in lots of different ways. It's not just about that initial sort of upfront investment, but it's also that ongoing cost. So I think really understanding, I guess, I touched on the sort of problem that one's trying to solve, but having a robust business case, but using that business case as a mechanism to sort of drive that throughout. And then finally, I think the only other sort of, opportunity and risk is around resourcing. And it's already been referred, but there is obviously an increased demand on the workforce as part of this change, and understanding again the different skills and capabilities that are going to be required of that workforce, I think is going to be really fundamental. And those sorts of things really need to be planned up front. And I think there are lots of great resources. We can probably come back to that a little later.
Yeah, they're great points, Ange. I want to return to a couple of those points as the conversation progresses. One that's important, I think, is around capabilities, and there's a piece of that puzzle which is about the capabilities that providers need and that staff and the workforce need. There's also a conversation about the capabilities that consumers and the community need to operate effectively in digitally enabled systems. So I'm really keen to explore that. And probably the second one is, how do we make good choices about the investments we make in technology, and good choices in the time and the energy that's required to actually ensure that digital technologies are adopted safely and effectively with a workforce that is under intense pressure. Before I take us on, Nathan, Julianne, I just wonder if you've got any other reflections or thoughts you want to add?
I really just
think the workforce.
Sorry,
I was just going to say, I think the workforce one is really critical. I only had 3, unfortunately, that I gave you originally, but I would agree. Workforce is incredibly important. And what we are seeing is that the need to bring them on the journey of digital adoption. As you know, in aged care, that workforce is on average older, and they are more resistant, and we're finding in certain pockets. So I think a dedicated program to bring that workforce in and really engage and see the benefits of digital is key to success.
Julianne, final comments from you?
Yes, I think just for our conversation today to be set in the broader context of what we're facing in Australia, the reality around ageing in place, that we have already 93% or thereabouts of older Australians, our residents are outside of government-funded aged care facilities and are living at home, and often a strong preference to remain living at home. So I think we need to be aware and alive to the fact that as older Australian adults are ageing, their preferences for how the depth and breadth of choices for how they will choose to live and where to live and who to live with is increasingly becoming more transparent and more obvious. And to that, I then draw upon the market differentiation. We obviously know about the boomers, but obviously we have cohorts of people coming through where they have very individualistic needs as distinct from one homogenous group. Therefore, the art of understanding the individual inside each and every person, of which age really isn't really the determinant. It's more their mindset and the set of circumstances that they have on any one day. And of course, while we all might default to thinking quite naturally, well, that's about residences and that's about older adults, but it equally applies to our workforce. It equally applies to the cold and our Aboriginal and Torres Strait Islanders people. So to the diversity of our country, the individualism of our workforce, and indeed those that we care, support, enable and allow to flourish. So I think that those points are important. And thirdly is the bridging of the supply gap that we have. Clearly, as has been mentioned by Nathan and touched upon by Angela, the workforce gap that we have is immediate and critical. And the digital interventions, when designed well through human-centred care, as we will learn more about throughout today's conversations through KPMG, are essential to supplying, ethical and well-grounded human-centred responses that enable lives of Australians to be improved upon into the future.
So I might take us on, to talk I can talk about operating models, because I think one of the things we all know from lived experience is there's often a big gap between talking about digital adoption and the practical realities of actually doing it in a complex mission critical operating environment, whether or not that's a network of home care personnel or whether or not that's in residential care. I just wonder, perhaps, Ange, whether or not you've got reflections. We've talked a bit about the workforce. I want to come back and talk about workforce capabilities. Are there other barriers that are really apparent to you to digital adoption in the sector that we need to explore today, beyond just workforce?
I guess it comes back to sort of anything that is part of that change. And obviously we talked about resistance, but the technology itself. So obviously it's critical that whatever technology choice that's taken is easy to use. And we know that sort of in the past, and we've seen a lot of this throughout the sort of history of digital health implementations, the tools that have been implemented haven't really been fit for purpose. They weren't necessarily designed in a user-friendly way, or designed, in fact, by users themselves. So designed by clinicians or designed by consumers. And so sort of thinking about that co-design context, and that sort of amplified, I guess, the resistance to that change. I think what we are seeing now, which is exciting, is that there has been a significant move away from that sort of implement without co-design kind of model. There's much more of a sort of a consolidated and collaborative model around that. The tools are there's definitely a better investment right up front from governments, say in the acute care sector is one big example where the tools are now being designed with clinicians and with users in place. Obviously the workforce is far more than just clinicians, and particularly in the aged care setting. So I think that while that has been a barrier, I think the opportunities presented by this kind of, I guess, almost revolution in aged care, if we think about what came out of the Royal Aged Care Commission and the investment that's flowing, I think there are tremendous opportunities, not just for aged care providers, but for vendors to be working really closely in partnership with the aged care providers, with the workforce, to make sure that the tools that are being implemented are going to be fit for that environment, fit for purpose, and also engaging, I guess, the consumers and the families. I know Nathan and Julianne have touched on that already, but I think that that's a really critical part of that sort of process.
Julianne, I know that the Centre for Modern Ageing obviously provides an important platform for sort of learning about adoption, digital adoption. I wonder if you've got some observations about the way in which that sort of user-centred design process is changing within the industry.
Yes, well, it's certainly becoming front and centre. And I'd argue that for people responsible for large procurement of products or services, be them digital or non-digital, that have responsibility for ensuring that it improves the welfare of both their residents or their customers and their workforce who might be aligned to delivering that product or service delivery or set of solutions for people, that a well understood pathway that the co-design has been ethical and transparent throughout the process from ideation all the way to prototype and out to market. At the Global Centre for Modern Ageing, we are fortunate to get to purvey the best of what, and the most interesting of what new products and services are happening around the world. For, as we all know, that ageing is a global phenomenon, not limited to Australia. And as such, the rise of organisations, both those that were traditionally catering for the aged care sector, but I would argue far greater is the emergence of new companies and organisations lending their investment and strategy to solving the problems to support the greatest cohort on the planet and the greatest growing cohort on the planet, which happens to be people over this age of 65. And I don't think that should be lost on Australian audiences or Australian procurers of large-scale products, or the importance of an individual at home wanting to get on a website and to buy a product or service that would improve their day-to-day living. What we haven't seen in the aged care sector until recently is a form of transparency. And we hear from entrepreneurs and organisations, both in Australia and overseas, how do they're interested in being part of the new supply chain of the future that delivers meaningful and impactful wellness products and services. But what does good or great look like? And where do they invest intelligently and coherently to allow those products or services? Now, part of this is really at the core of the operating model to make sure that financial investment is wise and prudent and does actually improve the wellness of individuals' lives and the workforces that surround that service. And we have at the Global Centre for Modern Ageing been working on a validation framework to bring a greater level of transparency for the aged care sector in order to test and validate particular products or services to see that they suit the fit for purpose environment. And that includes, as I mentioned earlier, not just the resident or the aged care customer, but also the employers or the employment workforce that sits alongside it. It will depend on whether they are in cold communities or our First Nations communities, and if it's in Australia, rural, regional or urban environments. Now, all of these things are incredibly important to understand that sitting alongside people's digital technology capacity today or into the future need to be aligned in real time. And it's that alignment. So 2 products that I think that we've been working on that will help to support the sector. One is a digital readiness tool that supports aged care organisations understand where they may fit as an organisation and its holistic response to digital solutions and how it fits in their organisation more broadly. And a second is the validation framework, which allows to reliably test and validate products or services of similar types to see which ones are best fit for purpose through a transparent program. And we look forward to bringing that to market later this year in 2023.
Thanks, Julianne. Just as a question, one of the things we've got in the chat is a question from the audience about the focus of this discussion and whether or not we're focusing that primarily on community care or residential facilities-based care, and I guess we were trying to cover both topics. So I just wonder, as you reflect on the development of that digital readiness tool that you've just commented on, does that respond to the needs of both community care providers but also residential care providers and other sort of sector operators? And
yes,
have you got any observations?
Yeah, no, look, I think it's absolutely, the framework is always being improved upon by its usage with particular aged care organisation, and it's in its stage of its early launch. So time will improve it, like all frameworks. But it is for the aged care sector, and whether it's public or privately funded, whether it's a sole organisation working inside a regional town or a hub and spoke model to a more elaborate or mature organisation, I think the strategy and the framework can be applied to both lenses.
Nathan, I just wonder if I can draw you into the conversation, particularly given that, given your experience and given most recent experience as a sort of entrepreneur and technology provider into the sector, whether or not you've got observations about both the changes within the operating model, but also maybe to step from there into some of the new capabilities that you're seeing emerge as being important for providers.
Yeah, look, we do have an interesting perspective, and look, my background, and I'll be talking mostly from a home care perspective, but obviously it does apply in residential settings as well. The stuff we're seeing is that people are starting to step into this space, and consumers, and if you think about the consumer in this setting, it's often the son or daughter who is looking for this answer initially. Their expectation levels for digital solutions are very high. They live with this every day with their children in daycare. They're seeing that firsthand. They're seeing the benefits of digital tools in care. And they're actually asking questions, why don't you have this? And why can't I see this? And why can't I talk to mum? Why can't I just send you a message directly? So the consumer is going to drag us into this, whether we're willing or unwilling. I think that what was really interesting, what Julianne was saying, is that consumer experience should be the driving force here. It is the greatest opportunity. I think historically technology has been used to improve our payment processes, our rostering systems potentially, but the consumer is really the one who should benefit most from this latest wave of digital adoption. What we are finding is hard for providers is the constant change in regulatory settings, and therefore that's dragging them back into back office solutions that they need. So we're really looking for clarity, particularly once again in home care. At the moment, it is some of the uncertainty in home care is stalling investment in technology at the moment, is our belief. But that said, it is actually the greatest opportunity to bring those two things together. That some of the changes in home care funding connect that to data and digitisation, and I think that change management process should all be encompassed to deliver a greater outcome for consumers on the other side of the changes. So we're now starting to see providers who are stepping in and starting to make small changes, although they are still hesitant around what the actual regulatory settings are going to look like down into the future.
So regulatory stability, sort of, and clarity of the forward roadmap, absolutely critical to digital adoption. Can I just ask a follow-up question, Ange? I want to ask for some thoughts from you in a moment, but Nathan, just can I ask you to reflect on consumer capabilities here? So, how important is the ability of consumers? So you talked about family and friends and expectations of the support network often wrapped around consumers that we're trying to put at the centre of care. How important is consumer capability as a barrier to adoption, or is it actually something that's overemphasised or overestimated?
Yeah, it's a great point. I do think sometimes it's overestimated. I think there are a cohort out there that we can co-design for and that are willing to step in, but the benefits aren't dependent on the actual recipient of care's adoption, in my humble opinion. I think those opportunities are there. Interestingly, when we first started Five Good Friends, which is a tech-enabled services business, we thought everyone would be wearing devices on their wrists and in their homes. The consumer desire for that isn't there, or it's only just coming to the market now. What we actually saw the real benefits from was the adoption by the family, as I said, and the care worker and the clinical team sitting behind. So the digital adoption and the benefits are actually being derived from around the consumer and that's benefiting the recipient of care because they're getting better decision making on their behalf. They're getting better communication between all the different players, and they're getting better outcomes, hopefully. But I do think the future, as we've been talking about, is to bring them in so that they actually benefit directly. And we're starting to see that adoption. Our adoption of the aged care recipient is only at about 20%, whereas sons and daughters is well over 85%. But we're seeing those trends both grow in the same direction.
Thanks, Nathan.
Evan, can I just make a quick comment?
Yep, absolutely.
Thanks. Just Nathan makes some really excellent points there, I think. One of the things I always go back to, and having been in this space for some decades now, and having been a sort of a clinician frontline, but also now dealing with family members, well, my mother in aged care, is that expectation management is really critical, because there are a lot of products on the market that deal or treat lots of different types of problems. And it is quite easy to be sort of, I guess, to see a lot of those bells and whistles and just be sort of dazzled by them. I think I'll go back to an earlier point I made, which was potentially as an aged care provider, is understanding, well, as part of this investment, we know that there are regulatory changes now. We know that there are sort of mandatory reporting requirements associated with this transformation, but that shouldn't negate that need to sort of go right back to that basic and just go, okay, well, why are we doing this? What is the problem we are trying to solve? And getting staff involved in that, staff and family, I think, and consumers, but getting everyone engaged in that process. And you can actually make that kind of fun in a way. You can sort of go through various different types of facilitated workshops, but until you really understand what sort of problems you have, then you can start going, okay, well, these are the sorts of solutions we need. Rather than having solutions that look for problems, you actually have your problems identified, and the solutions will flow. But it also reflects that there's a real variance in maturity. Obviously, there are some that are just starting out that, will need a lot more support. But then those that Julianne and Nathan, I no doubt, have been working with the full gamut. But those that are sort of right at the top of their game, who've had the opportunity to make substantial investments and are sort of starting to see those real benefits flow. So I think when you think about the sort of prioritization and the benefits, you need to sort of think about, well, these are kind of, we may have a full set of benefits. We may not see them realised up front, but sort of prioritising those and understanding the expectation around it, I think, is probably really important.
I'm keen to actually take our conversation to exactly that topic, Ange. I want to talk a bit about benefits. And maybe, Julianne, before I ask you to do that, I think, Ange, just to reflect on your last point, one of the challenges for providers is often that in terms of digital adoption or digital transformation, it's never a one-speed race. Nathan, you talked about providers sort of through regulatory reform being pulled back to a focus on often back office systems to enable improved reporting, but doing that alone actually often kicks very few goals for frontline care providers or caregivers, often kicks very few goals for consumers. So often it's not enough to do one thing. Actually, good digital transformation is often about being able to walk and chew gum, if you like, in relation to implementation. And so maybe, Julianne, just to take us on to benefits, I wonder, because I want to talk about investment later on and investment decisions. Benefits are a really important part of that. As you sort of reflect on the experience through GCMA and the conversations you're having across the sector, where are you seeing the sort of greatest benefits? I know you talked about consumer-centeredness earlier. I wonder if you wanted to sort of think about your top 3 or 4 benefits or pools of value for digital adoption.
Well, thank you. And I guess it depends on benefits are in the eye of the beholder, right? So if we talk about it at a sectorial or an aged care organisational perspective, I'd say the benefits of a well-framed scan or screen to understand what are your unmet needs, to use Angie's terms a little bit earlier there, of what's the problem you're trying to solve, and as importantly, what are the North Stars? And these are new North Stars. Having co-design at the centre of the frame of decision-making hasn't really been in our vernacular for too long, but it certainly is front and centre now. So what are the North Stars that we hold ourselves to account as organisations and as a sector at a regulatory level? And the solutions to those, the how then is quite interesting. So I'd say the benefits of a well-framed and screened framework to understanding those unmet needs and looking at digital solutions so that they don't bombard management and staff or boards, but there's an easier way to dissect what's available in market to meet that need, and taking account of the integrated solution, so it's not living on its own in isolation. Some products work plenty fine, in an isolated environment. It's how they integrate and invent themselves into the real working life and workplaces of places. And these are easy things to say on a seminar. These are not easy things to play out in life. And so I think those frameworks are going to be super important to providing transparency, greater confidence and clarity. And then we drop to, or should I say we rise up to, the most important level, which is how does it interface at the coalface of the residents, because there's no linear view on what works for board and management. Obviously, the success for board and management will come from what I'm about to talk about next. And that is how it works for the resident or the customer of aged care provision, alongside their family and friends who are supporters, enablers, and help them to flourish, but also at times help them to make decisions if they are in requirement of having somebody to support decision making. And therefore the workforce that extends alongside it. So the benefits for them is that they know that the new product or service or the curated products or services are built with them in mind, built for the circumstances in which they're operating. So once again, the next benefit will be that knowing the confidence that it's used and localised in their environment, and that this set of suites of solutions will work as intended and as the investment was made. Let's be sure that the investment that we're talking about isn't just the financial investment. There's a learning curve for all of us involved in change. And the workforces who are asked to learn new ways of procedures or new services or to take new products to market, be it into a residential home or into an individual's home, is no small ask. And so we need to be sure that what we're asking of our employees is something that enables them to work well and is within their capabilities. The third part of this is not all of the onus is on the aged care provider or even the residents. Indeed, this is a shout out to the technology platform providers and the technology product developers. And here's your challenge. If you want to be part of the greatest uplift of opportunity to improve humanity in the next 30 years, greater, more intuitive products and services to market is key. We talk a lot about, does the workforce have the digital capability to take on the technology? Well, perhaps that's because the technology isn't fit for the end user. So the more intuitive the product design is for the capability of the masses of the workforce, the better likelihood we have of affordable solutions making their way to ground across the nation more quickly. So I see that as the third set of benefits.
Thanks, Julianne. Nathan, I might just ask for your thoughts on benefits, if I can, from the work you're doing. Where are you seeing providers getting the greatest, or consumers, residents getting the greatest benefit from adoption?
Yeah, we're seeing the real value is playing out in delivering transparency and bringing the full picture to all key players in any episode of care. A great example I'll give is during COVID we saw one daughter managing a father from Queensland. The father was based in New South Wales. The care worker was in New South Wales. The care team were located in Queensland from memory. They were able to work together, sharing information from notes left by the care worker that the clinician saw, could then reach out to the daughter. She was able to write back and include the care worker in that conversation in real time, and then to come up with a plan to sort of manage certain behaviours that were happening in the home in a remote location. So that inclusivity, and I can see the question there around interoperability, that interoperability is incredibly powerful. And I know there's challenges when it comes to that part of it, but we're really starting to see transparency and including the consumer and their family is actually where the value lies in our mind. And yes, technology does an awful lot to help automate and drive efficiencies, but it really is that benefit that we think is the greatest at the moment.
Ange, I might draw you in. You talked earlier about the importance of clarity around the problem and ensuring solutions matched it. There probably isn't a bigger challenge or barrier than interoperability. I just wonder whether or not you want to share some reflections on how providers can approach that and the work that might be being done in other parts of the sector that has things that we can learn from.
Great question, Evan, because it is, I guess, to use Julianne's term, our North Star. Having been in this sort of environment for some decades, as I've indicated, we've talked a lot about interoperability and integrated care, but we still haven't sort of been able to really crack that nut. And I think there's a range of reasons why that is the case. And when I refer to interoperability, I talk about information sort of following people into whichever environment they may go. So, in the last few years, we've obviously seen the My Health Record expand. I was part of that program back at the Digital Health Agency. And the reason that that particular solution exists is because we haven't yet had that opportunity to have information sort of follow people into whatever environment they find themselves, whether they go from a acute care setting back into aged care, whether they go from general practices to specialist care. Most of that information exists in silos. And we've certainly tried, I think, as a health system to sort of patch those problems. We provide discharge summaries electronically and we send them off to various providers. We send medication reconciliation charts and so on to and from different environments, but we haven't yet been able to have that situation where that information follows someone from one location to another. And I think when people talk about integrated care, that's kind of the nirvana of interoperability. It's where all of that is humming along nicely together. So I think it's still a North Star, but I think in planning for a solution, Julianne's already highlighted this. You're obviously considering not just what works for inside your immediate environment, but what is also going to work when you're transitioning your residents or your patients in and out of those settings. And we already know that transitions of care are among some of the highest risk events that occur in the system. And typically they affect elder people because they're the ones who are moving from aged care settings into acute care environments and back again, and so on and so forth. So I guess thinking about that sort of more strategic picture when thinking about those particular systems that you really need to be thinking about, what does it mean when I move my resident into an acute care setting? What's going to happen to that flow of information? And how are we going to sort of most strategically sort of prepare for that? So I think you may not be able to find a solution straight off, but I think understanding that there's some of those challenges that need to be addressed as in the sort of procurement phase, then it's possible that as a roadmap, you can sort of identify, well, these are the various steps that will take us there, because there are some solutions that are all-encompassing. It's just that it might not necessarily be possible from the get-go.
Can I just add to that, Evan, really quickly? I think the question around interoperability is often clouded with the challenges around privacy and protection of data. And I think the two have to walk side by side. And once again, the opportunity is to really enable transparency to the end user of who has access to their data. And I think if we can, and I'm really excited to see the ADHA is working on an interoperability plan between residential aged care and the acute setting through My Health Record. And we can't wait until they want to turn around and start looking at the same project from a home care perspective. Because I think you're right, those transition points are really key. And at those points, I think you want the consumer to be able to opt in or out of who actually has access to their data, or at least have full full information of who can see it. And that, I think there's an opportunity for at those transition points to enable the consumer to just double check that they're comfortable. And then that will free up the interoperability, because no one's going to say no to sharing data with my physiotherapy so I can rehab at home. But it's a fear of what data's out there that is actually clouding some of those opportunities.
Thanks, Nathan. There's a great question in the chat which we were going to get to, and I'm keen to maybe bring it forward a little bit about the very difficult decisions that are made by all of the people in the audience on this call, whether or not they're sitting in a governing body or as part of a board or they're an executive at a service provider. How do I make good choices about investments in digital technologies is really the question that's in the chat. What questions should I be asking as I'm looking at a business case or a request for funding? And so, Julianne, I might start with you on this one. What are the most important questions for people sitting on governing bodies or in executive roles to be asking as they're looking at investment in digital technologies?
Well, that's a big question for a quick minute, and I'm more than happy to give a more dedicated responses to the audience later. But, you know, essentially it is, what's the unmet need that it's solving? How easy will it be to integrate into the lived experience of those who are most in need? What will be the training that will be required, and is my workforce prepared for it? What are the products or services that are globally available that have been localized and could be available for you to review and to see, and to potentially have a pilot test of, or who has conducted a pilot test that you can learn from? So transparency about where the research comes from. I'd add to this as an underlying caveat of evidence-based research, not hearsay, and not marketing spiel that may come from particular product developers themselves, but evidence of how it's working. And being realistic, I guess, as anybody who's ever run a company or been responsible for working into one, is what are the resources that we have that are available to suit this unmet need, and where could we potentially collaborate with others? So often we hear from the aged care sector, from individual organisations, but over time we get a collective message that so many share very similar struggles or challenges. And how could it be that we could help support the sector having greater transparency around how to test and validate the products or services in market? Now, organisations like ours perform those services, but I'm also mindful that the money that sits inside, or the funding, is there to really support residents' primary care. And yet there is an overarching need for this higher level of learning and inquiry to inform better procurement. And so reaching out to consultants isn't a bad idea, but being sure that who you speak with can understand the environment by which you're operating in. And we're more than happy to share our knowledge that we've gathered from desktop literature reviews, and where possible, what we're learning in market. But more broadly, that is the product that we look to take to the aged care sector this year, which is a more transparent validation framework that allows them to make those logical choices with a step-by checklist that takes into account the sorts of circumstances I just provided to you. The final comment I'd have is, it's one thing to buy the product or service, it's another thing to embed it in the community where it needs to be of use. The third is, what's the ongoing maintenance and support of that product or service, and how it will integrate later. So as I mentioned, these are not easy considerations, but they can be thought through carefully and methodically. So they're not above us, but it does require a different level of framework thinking than we've been required to take in the past. It's a new part of our risk mitigation and assurance strategies.
Thanks, Julianne. Nathan, I might ask you for your thoughts. That was a pretty great list, Julianne, as a starting point. Nathan, additional questions that as a governing body member or executive you'd be asking?
Yeah, look, I think every provider is at a different stage of this journey, so it really comes down to where they're at. But the first thing is to analyse the data that you have at hand. So things like incident reports, things like customer surveys that you might be doing, workforce surveys, understand what the problems are to the point that's been raised a couple of times. What is the problem you're trying to solve? And start to map out that sort of order of priority for you as an organisation. We often see people just start really small because they might realise that the data they've got today isn't actually enough to understand what their problem is. So you might encourage them to just implement some net promoter scores or some other type of data point that's really simple, till they can start to build out a bit of a picture of what's good in their organisation and what's not good. And then that will then start to inform in a more individualised way what the opportunity is for that organisation. So if you're seeing a lot of incidents that involve manual handling, well, maybe you need to start to move more into your starting point might actually be a learning management system and that integrates to the core operating platform, as opposed to trying to do everything at once. So it really is, I think, just understand the data you've got. And I was at an IT conference last week in Sydney. I was really chuffed to see all these new chief or head of data transformation roles sort of emerged in the industry. People are really starting to understand the data they've got, converting unstructured data into structured data and gathering and aggregating structured data. And there's a lot to learn before you step into some sort of digital transformation process just with what you've got at hand.
Thanks, Nathan. Angela, your thoughts?
I guess the only other thing that I would say is understanding what you must have versus what would be nice to have. Sorry, I can hear the garbage collection outside my window here, so hopefully it's not too shattering for you. But there will be some requirements that are absolutely mandatory. Obviously, you must have a solution that can manage medications broadly, for example, whereas something that might sort of be able to integrate with some kind of wearable, for instance, or could be a nice to have, certainly down the track potentially, but understanding, I guess, that there is a variation there, that there are some things that you must have versus the should have and the could have or nice to have. So that's probably the only other thing I would add there.
Thanks, Angela. Can I take us on just to talk perhaps about capability? So I've been keeping a bit of a running tally in the background of our conversation about the things that I think you've mentioned over the course of the last 50 or so minutes that might be capabilities. And I thought I'd run you through that list, get you to add capabilities I've missed, and then maybe talk about relative level of priority. You can also remove capabilities from my list if you think they're wrong. So no order of importance here. I've heard a capability that is pretty critical around strategy and priority setting. So am I clear about the problem? Am I able to prioritize those problems? Am I able to track problem to solution? So I've called that kind of strategy and priority setting. A piece that's around data. So can I actually better understand, what's going on in my organization and can I quantify problems? So I've called that data and analytics. Procurement, right? So quite an important capability about can I actually help? Can I manage the market? Can I be an effective actor within the market that I'm operating in? So I've loosely called that procurement. Consumer-centered design, or at least consumer-centered planning. I've sort of added that. A capability that I think exists around integration, interoperability. Can I get the technology that I buy to talk to other technologies that I already own and technologies in the sector more broadly? And then my final one is around privacy and security. So I'm going to collect more structured information, I'm going to stick it in a system. Can I have trust that it's safe? Can I ensure that if I'm going to share it, I'm sharing it appropriately? So they're my 6 capabilities that I think our excellent panel have sort of talked about. Did I get that right, panel? What would you add or subtract from that list?
That was a good list. Well done.
It's a great list. I just would maybe move forward, if I may, the comment about consumer-centered design, and it wouldn't surprise you that a person like myself standing in front of a banner like this would say that. But I mention it, and why I think it's important is because it captures into the strategy and priority setting. So understanding what happens in strategy and priority setting often can happen as the domain of management and boards and executive teams, and sometimes into their workforces, but it doesn't always capture the human-centered design of the very end customers and their friends and families. And I think that needs to be embedded in the early strategy session, so that whatever is being discussed at a strategic level has, real relevance and currency, and that is evidence-based. So that would be my only small addition to your great list that you've already put there.
I totally agree. I think if you put the consumer experience at the top of the thought process as you work your way through those other areas, you'll make better decisions. And it may, as Julianne said, you may find that your strategy isn't focused enough on the consumer when you first set out on this journey. So that's really important to lay down and understand what experience do you want for your consumer and everyone involved in their care. And I think that will inform better decision making. Often you see the loudest voice in the decision-making process being someone who's got the highest amount of power, whether it be in finance or people or wherever it might be. The consumer's voice needs to be held out in front of those voices as you make these decisions.
Can I just make a quick addition, Evan?
For sure. Angela?
Just to governance. I'm not sure we've really covered off governance, but I think that's obviously critical. Obviously, there are is already great governance in place by all of these governing bodies, but sort of ensuring that whatever sort of, from start to finish or ongoing sits inside that central governance. And obviously clinical governance, clinical and safety governance is a very critical part of that, but there must be ongoing governance around all of the decisions, around management, monitoring of risks and issues, and so on. Otherwise, if it sort of slips off to the side, then, that's where there's trouble.
And there's two parts to that, aren't there, Ange? There's a piece that's about the fact that digital adoption does change our risk profile. It changes the nature of risk in care settings. And the second component is that we're also creating new risks, particularly implementation risks around how we manage programs, how we manage change, which you talked about earlier. So for governing bodies, for executives, I think enormous opportunity from digital adoption, lots of benefits that can flow, but we're also creating risks, new risks that need to be managed.
Absolutely critical. And I think, you look at medication as one very quick example, obviously where medication management really stands to sort of benefit from, from this transformation. But typically, if there is some kind of an inbuilt error built into the system, obviously that can be something that might impact hundreds of patients, for instance, where it may have just been one patient previously on paper. Similarly, the same sorts of things can arise sort of at scale. And I think understanding those new risks as you identify them is also critical part of that governance.
Nathan, I am going to indulge my sort of chair's prerogative. We have 1 minute left, so this is a quick answer to an important question in the chat. You talked about adoption of technology earlier by consumers, but there's also a question about what percentage of, so the question in the chat is, what percentage of staff or care workers do you think are leaving the sector due to not being able to cope with the expectation of data literacy? So the provocation there is people leaving the sector because they are scared of technology. And I wonder for the panel whether or not you'd comment on that as a provocation, but also the counterfactual, which is what's the opportunity to attract people to the sector if they're working with technology? Our final question for the day, thoughts, Nathan, starting with you.
Yeah, look, I think it's a great question. I think someone said it earlier in the panel, setting the expectation right of what you want of that workforce. Don't raise it too high. They're in the industry for a reason. Keep it simple. Keep the user interface simple. I know in our technology we ask them just two really simple questions as they leave the house, so that we're extracting data and then we're letting the AI and the clinicians do the work. So really understand what you need of that workforce and do keep it simple. And if you do that, you will get 100% adoption. And at least then you've got a base you can build on going forward.
Thanks, Nathan. Last words, Angela and Julianne.
I would just say, look, apart from anything else, it's a wonderful opportunity. We've talked a lot about the challenges and risks today, but there are some really great benefits from going digital. There are some really tremendous resources out there, and I'm happy to sort of be contacted separately about how one might find them. But I think it's also a really exciting opportunity that can lead to great change.
Thanks, Ange. Julianne, last words.
Well, I think that the reason why people leave workforces in the aged care sector are many and varied, and I think that's been well publicised by the Royal Commission and other commentators since then. And so feeling supported and feeling capable of doing the job to the best of our advantage. And I think that's where the opportunity to digital technology really lies. It's never there to replace the high-touch, human-centred focus. It's not the intention. The intention is to take from the burden of the more rudimentary roles and perhaps around paper documentation and monitoring in ways that don't require the intimacy of person-to-person care, and allowing carers to be elevated in their role and their station for the very purpose, their North Star for being in the operation. We spoke today that digital technology creates an enormous amount of new risks. That's true, but I also see it differently. I think through properly and ethically conducted co-design of the products and services and their integration into the sector, we are creating greater transparency through frameworks, and we will be removing some of the other risks that have been created that digital technologies can actually help to solve. But at all times, whatever we do as companies and associations and organisations and government, it must be with the human-centred focus of all that we do. And when we keep to that, I know that we can work in greater collaboration to better benefit here in Australia. And I know that the world is looking at Australia for the way it invents and thinks about humanity. And whilst we are certainly on a path in our nation to improvement, there's an opportunity for the aged care sector to also feel proud of the very and many great contributions and improvements it's been making in really challenging times. And let's see technology as a strategic tool to improve the workforce and the residents and the management and the boards, rather than the only instrument of change. Thank you.
Thank you, Julianne, and to our panel, thank you so much for being here today. I hope all of you in the audience have enjoyed and the conversation as much as I have and have taken as much out of it as I did. Directly following today's event, we'll be sending you an email with a link to give us some feedback on the session. Please do take the time to do this. It's super valuable for us to hear from you about what you thought of this session. We're trying to adjust the experience as we progress through these webinar events, and your feedback really matters a lot to us as we're doing that. Please also ensure you take a moment to complete the diagnostic tool if you haven't already done that. As mentioned earlier, we will make sure that you've got access to related learning activities shared in the reminder email for the event. I talked about those resources earlier. And please do put in your diary the next webinar, which we've scheduled for the 29th of March. We really hope that you can join us for that one. We're going to be focusing on strategic planning, such a big important topic from our conversations today, and how we use strategic planning to really put humans at the centre of care. Again, from our panel to all of you in the audience, thank you so much for being here with us today. We appreciate it. And from us to our panel, from the audience to our panel, we really appreciate you taking the time. Thanks very much. Have a great rest of your day.